How does prostate location affect ultrasound imaging? Imagine trying to see inside a complex maze. Knowing where each wall and corridor is makes all the difference. The same idea applies when doctors perform ultrasound imaging of the prostate. The prostate is a small gland located just below the bladder and in front of the rectum. Its position is key to how effectively ultrasound can visualize it. Because it sits right next to the rectal wall, the most common and effective way to image it is through transrectal ultrasound. This technique involves inserting a small probe into the rectum, which is very close to the prostate. This proximity allows the ultrasound waves to travel a very short distance directly into the gland, producing detailed, high-resolution images. Ultrasound waves weaken as they pass through tissues, so being close means clearer images and better detection of abnormalities. The prostate's position also influences which parts are easier to see. The lower part of the prostate, called the apex, and the outer regions known as the peripheral zones, are more accessible with transrectal ultrasound. These areas are often where prostate cancer develops, so clear imaging here helps in early detection. Advanced ultrasound techniques like elastography have shown higher sensitivity in imaging the apex, thanks to its favorable location near the rectum. However, the prostate's position can also cause some challenges. The surrounding tissues and the rectal wall can create shadows or artifacts in the images, which might hide small or early tumors. Ultrasound alone isn't perfect at telling benign tissue from cancer, because the gland's complex structure varies from person to person. In clinical practice, the proximity of the prostate to the rectum makes ultrasound-guided biopsies possible. The doctor can use the ultrasound images to guide a needle precisely into suspicious areas for tissue sampling. This targeted approach improves the accuracy of diagnosing prostate conditions. So, in summary, the prostate's location next to the rectum allows for high-quality imaging with transrectal ultrasound, helps visualize key zones where cancer may develop, and facilitates precise biopsies. But it also introduces some limitations due to tissue interfaces and artifacts. Understanding this relationship helps healthcare providers choose the best imaging methods and interpret results accurately, ultimately supporting better diagnosis and treatment planning. Always remember, if you have concerns about prostate health, consult a healthcare professional for personalized advice.